Today I am coming out with another topic, that is brain death, criteria for declaring brain death and its implications. So what is brain death? Brain death means complete and permanent loss of neuronal activity of the brain. The person's visceral organs remain in functional status due to assisted ventilation, and this is called vegetative state of the person. Now, what are the mandatory exclusions before a subject is declared brain dead? The first thing that should be done is whether the person is under intoxication from drugs, alcohol, or metabolic toxins. And sometimes the subject might have used relaxants, muscle relaxants, and sedative drugs. So one should also exclude whether he has any primary hypothermia or it could be hypovolemic shock. Sometimes the persons may go into this sort of status due to metabolic coma, and it may be due to endocrinal coma. So in which case one should be careful in excluding these factors also. And one should also look for whether there is any brainstem encephalitis. This is of course rare cause, but one should look for it and avoid this. And is there any muscular relaxants which the subject has taken which must have caused the present status of the subject? Now let us see the criteria for brain death. Number 1, the person should be normothermic and normovolemic, and he should remain in a state of coma, and the subject should exhibit apnea with his arterial blood CO2 levels rising to more than 50 millimeter mercury. So he should also exhibit a non-reactive but dilated pupil, and one should see there should be a loss of conjunctival and corneal reflexes. One should also look for the brainstem reflexes like chewing and swallowing, and these should also be looked for. And another important feature is the oculocephalic reflex, otherwise called doll's eye movement. It should be negative in these patients. And then the subject should not elicit any response to pricking of nasal septum. These are the criteria that are to be taken into consideration before a person is declared brain dead. One should also look for the following before a final decision is taken with regard to the brain death. Of this, number 1, recording of EEG, which should be flat. There should not be any waves. The second thing that should be taken into consideration is the recording of brainstem auditory evoked potential, which should exhibit loss of 3rd to 5th phases. And the third thing that also is considered to declare brain death is the recording of SSEP from the median nerve, which should also show absence. So all these three would give additional information to decide on the status of brain death. However, now to say that the brain is dead, two doctors should certify about the status of the brain function, and only after declaration by two doctors it should be declared as brain dead. Apart from that, if it is in the case of adults, the waiting period is for about 12 hours. And if it is children, one should wait for 24 to 72 hours before the declaration about the death of brain. Now, what are the implications of brain death? So once it is confirmed that brain is dead, there is no question of revival of this patient to normal activity. Only it is a matter of time and he would live as long as he is provided with supporting system. So in such a situation, once the two doctors declare that the brain death is now total in a given subject, and they should think alternatives. The doctors should think alternatives once they confirm brain death. What are these alternatives? They should think about harvesting the visceral organs which are still functioning after taking permission from their near and dear and other relatives. These organs can be transplanted safely to those persons who are in need of these organs. Thank you very much for listening to my video.